Thank you, Mr. Chairman. Dr. Holtz-Eakin, does taking $1 trillion out of healthcare help the American people or hurt the American people?
Depends how you take it out, sir.
So you're saying that there could be a benefit?
I think if we had higher value care that didn't have excessive procedures but produced high quality outcomes with less procedures, that's the goal for everybody.
You support eliminating federal dollars with Medicaid?
Again, it depends how you take those federal dollars out.
That's not a no.
It's not a no.
I'll ask you the same question. Does taking $1 trillion out of healthcare help or hurt the American people?
Yeah, I mean, I think if we're going to get more affordable health care, we need to reduce all of the federal subsidies for inefficient health care.
Look, this is not a new issue right now of the skyrocketing costs with healthcare premiums, man. Everyone's known about this for a long time. I was surprised to see the numbers that suggest that 3 and 4 beneficiaries of these tax credits are from states that voted for Donald Trump. I'm surprised by that I'm not seeing my Republican colleagues lead this charge to make sure that people are not going to see sticker shock. Now, that aside, Dr. Blais, are you okay with junk plans coming back and being sold to the American people? Do you know what they are? Are you okay with the American people being sold by insurance companies an insurance policy that says, even though you might have cancer, I'm going to cover everything but your cancer? Are you okay with that?
I am absolutely not okay with insurance.
That. Sir, are you okay with that?
No, sir.
I appreciate that. So I hope we can agree here that we should get rid of junk plans because President Trump brought them back. As a matter of fact, there used to be disclosures on state insurance websites that said the plan you're buying in your state might not cover ambulatory care, it might not cover your cancer, it might not cover anything because it's just a gimmick. They want to look at those premium prices. Go back and look at what happened when you got rid of these gimmicks, these lemon laws. You know, can't buy a used car if it's a lemon, if it was in a flood, but hell, you can buy an insurance plan if it doesn't cover your cancer. You know, if you hurt your right foot, it might cover that, but not if you hurt your left foot. I hope that as we talk about this, that my Republican colleagues are willing to do something that my House Republican colleagues actually authored and say, extend the tax credits and let's work on reforms. Let's work on policy. My Republican colleagues are in charge of the House, the Senate, the White House. I get it. They voted against the Affordable Care Act back in 2009. They led efforts, 70, 80 times to eliminate the Affordable Care Act. By my count, I might be wrong by a couple votes here and there. Fine. Republicans, during President Trump's first term, said that they were going to repeal the Affordable Care Act. And then that got a little sticky politically, so then they said, we're going to repeal and replace. Are any of you aware of a replacement plan that has been put forth, that has been marked up in the committee? Sir?
There was a replacement plan that passed the House of Representatives.
Not currently.
I'm not currently aware.
Mr. Armitage?
Definitely not aware of it.
I'm not aware of one either. I've sat on the Help Committee. I sat on the U.S. House of Representatives Energy and Commerce Committee. I'm now on the Finance Committee. I'm not aware of one. I appreciate the conversation today because we should be talking about reforms and making healthcare more affordable and accessible. During COVID, we said, look, hey, you think you're sick, you're going to get a test, so that way we can make sure we get you help. And if you're sick, we're going to make sure we get you help. I survived a stroke 3 years ago. I'm alive and well today because of access to care. What happens if people just lose coverage, man? And that's what we're talking about right now. There's sticker shock that people are trying to figure out. I would hope that affordability means something to folks, and that means that people should be able to afford what they're getting. All of a sudden, if people can't get, if someone had a stroke like I did, you're dead. No questions. You can't get to the hospital, and if you're lucky to, then you're going to lose your home because the costs are ridiculous. Let's work together here. I think that there's some ability to compromise and figure this stuff out. Get rid of the junk plans. I'd be happy to author something with any one of you. I mean, heck, Kelly, we should just do that right away. And let's see if we find a Republican co-sponsor here to get rid of these junk plans, man. Let's tell the American people we're going to be honest with them about what you're getting and what you're going to get covered. And the last thing, Mr. Armitage, I want to say thank you for you being here and have the courage to speak up. I understand that some of my colleagues were a little tough on you earlier. I apologize for that. We need more people like you, not just here as witnesses. We need more people like you elected to the United States Senate. My father died because of a bout that he lost with stage 4 lung cancer. My dad was an iron worker. My dad was a welder. He was an expert with temperature fluctuation of metals and the torque it took to keep buildings standing. He never smoked in his life, man. But he died from this horrific disease. I want to thank you for the courage to be here and be willing to share your story and what everyday Americans are going through. Thank you for having the courage to be here. Mr. Chairman, I'm sincere about this. Let's get rid of the junk plans. Let's find a way to do some of this stuff. Let's look at other reforms. And if anyone wants to learn how I survived my stroke, man, I'd be happy to share with you. But access to quality care matters. It saves lives. And we can also make sure that we just allow more prevention to be involved in our lives. If we can catch all this nonsense early on in our lives, hell, we're all going to be healthier. Healthcare costs will go down. There shouldn't be a fight there either. So appreciate that, Mr. Chairman. I yield back.
Thank you. Senator Tillis.